695, you see the seldom case of an ovarian carcinoma metastasizing to the cava inferior.
(697) depicts a colon carcinoma of the left flexure near the hilum of the spleen. And 698 demonstrates the diagnosis of another left flexure colon carcinoma via fine needle puncture. Note the tip. 699 is a simple self-limiting diarrhea only. And 700 shows another colon carcinoma of the left flexure. While 701 depicts the typical features of a colitis ulcerosa. Typical diverticula are shown in 702 as a covered perforation with a long gas street in 703. In 704, you find the typical local pain and inflammation signs of the diverticulitis in the colon descendens. Note the palpation. And 705 shows another typical inflammation in the sensory diverticulitis. Again in 706 with a color flow additional. And the typical endoscopic feature in picture number 707. In 708, you see normal colonic gas in the descendants, while 709 shows another case of severe colitis Crohn of the descendants. And 710, another case of heavy inflammation in the sensory diverticulitis of the sigma. This has formed in 711 a probable abscess shown in bubble technology. Another echoscopic and endoscopic picture of diverticulitis is shown in 712, whereas 713 demonstrates a typical abscess formation after long-standing diverticulitis. A sigma carcinoma again is shown in 714. And in 715 and 716 you see the typical and seldom endoscopic and first echoscopic feature of a tooth pick perforation of the sigmoid. 717 was erased, and in 718 you see the echoscopic and the endoscopic feature of a sigma polyp. 719 was lost again, and in 720 you see the typical feature of the Crohn's disease long-standing in the left flexure.
And 721 is the result 5 days after an ischemia.
As well as you find it in 722. In 723, please observe the big lymphadenopathy. And in 724, a not so really seldom incidental finding a kidney carcinoma. In 725, we return to the topic of colitis, now in the sense of a chemotherapeutically induced colitis. Another segmental ischemia is seen in 726, whereas in 727 you see another 5 days old ischemic colitis. In 728 you can realize a really huge sigmoid carcinoma, while 729 represents the seldom case of a segmental amyloidosis of the sigmoid and the stomach. The sigmoid shown with our two eyes in 730. And in 731 shown in echoscopia in the stomach. 732 depicts a typical phlegmona of the sigmoid, treated endoscopically as well, of course, as shown in 733. 734 was in the end seldom a case of a malignancy of the small intestine.
735 shows another sigma carcinoma. 736 is a further sigmoidal abscess in Crohn's disease. In the next 737, we find another retroperitoneal malignoma.
In 738, a non-classified colitis represents a typical fish eating only after laparoscopic cholecystectomy. And in 739, it was a typical ovarian carcinoma with wall thickening. 40, it is a predominantly cystic aspect. Suspicion remains, however. In 741, you find a nice and normal hydrocolonosonography. 742 was a small acinus carcinoma. 743 was a involvement of small intestinal diverticulitis. While 744 was both diverticulitis and carcinoma. While 745 was normal anatomy of the pelvis.
746A is demonstrating a enteritis. 746B shows a peritoneal carcinosis with ascites.
747 features a chronic enteritis. 748 shows a diverticulitis infiltrative to the urinary bladder. And the same is true in 749. In 750, you see the natural result, pneumaturia. In 751, you see an echoscopic and endoscopic feature of colitis. In 752, you see a typical lump of facies dyschizia. 753 is a cava thrombosis in an underlying malignant disease. And 754 shows malignant lymphoma. Whereas 755 demonstrates a carcinoma of the Kohlraus plica. In 756, you see a radioperitoneal tumor. And in 757, a typical uterus myomatosis, which is repeated in another patient in 758. Whereas 759 shows as a normal finding an intrauterine pessar. In 760, you see another suspicious ovarian cystic structure. And another ovarian tumor is to be seen in 761.
In case 762, we found a tumor. The patient denied further clarification.
And 763 demonstrates a pararectal abscess in Crohn's disease. While 764 corresponds to a rectal carcinoma. And 765 to a typical colitis ulcerosa. In 766 is to be seen the typical endoscopic aspect.
In 767, we found another pararectal abscess in severe Crohn.
768 shows another rectal carcinoma with local metastasis. Whereas 769 shows simply shit in the rectum.
770A is a hydrocolonosonography. 770B is a rectal carcinoma in a hydrocolonosonography as well.
771 shows a thickening of the walls, which was in the end a reason a carcinoma too. And 772 again shows a typical dyschizia in two planes. And 773 finally shows a simply forgotten tampon. 774 to the very end shows another rectal carcinoma. You are well off today in that you have numerous excellent textbooks of clinical ultrasonography.